very, very important role of surveillance for this breast cancer in the patients who have a mutation positive in BRCA1 and BRCA2. So this is an enhanced surveillance which we should be doing, or intensive surveillance which we should be doing in these patients with BRCA1, BRCA2 mutations. Now, what are the components of the surveillance and what is the age when we should start with the surveillance? Now, these high-risk women, the surveillance should be started almost from 18 years of age by a monthly cell breast examination. So, first component of the surveillance is a monthly cell breast examination, which should be started by 18 years of age. Although a lot of studies and guidelines have shown that cell breast examination is not a very important part of this surveillance, is not a very effective part for surveillance, but still the patients are advised, the guidelines say, the American Cancer Society guidelines say that the patient should be advised a cell breast examination so that they have an idea, of the architecture, of the texture of their breast, and they can pick up any changes as early as possible. Apart from this, a clinical breast examination should be done twice yearly, that means 6 monthly, starting from 20 to 25 years of age, or 5 to 10 years earlier, or 5 to 10 years earlier than the age of onset, of carcinoma in the family member, whichever is earlier. 5 to 10 years earlier than the age of onset of breast carcinoma in the family member. So, two things which are important first in surveillance is a cell breast examination starting from 18 years of age, and a clinical breast examination 6 monthly starting from 20 to 25 years of age, or 5 to 10 years earlier than the age of onset in family members. Then what are investigations which are useful, which are required in surveillance of these patients with high-risk mutations? So, one, we have seen earlier while talking on the section of, investigations for breast disease, that one of the most important investigations for, surveillance of breast cancer, screening of breast cancer is mammography. That's in fact the investigation of choice for screening of breast cancer. This we have discussed. But, in these patients who have these mutation BRCA1 or BRCA2, we have to start a screening much earlier, surveillance much earlier. And, it's not advisable to do mammography in females less than 30 years of age. So, here in these younger patients, we have an additional role of MRI in screening these individuals or screening these patients.